My parents found that I very much enjoyed taking things apart to see how they functioned and then put them back together. And it's always been an interest of mine. My father was a dentist, and my older brother's also a urologic surgeon. And so it was kind of handed down. I knew that I wanted to deliver orthopedic care and eventually focused on the shoulder. And now my effort is to provide the best orthopedic shoulder care to the Treasure Valley and the surrounding tri-state area. I'm old school. I believe that the patient will tell you the diagnosis if you ask the right questions and you just listen to them. Find out what they're experiencing. I always try the conservative management first, no question. And that may be injections, that may be physical therapy. We look at the diagnosis and I discuss those options with the patient. I believe that any type of medical decision making should be shared between the patient and the doctor. If they were my family, and knowing what I know, what would I prescribe for them? So when conservative management fails, you can discuss those surgical options with the patient and make sure that you're all on the same page. I believe an informed patient is a very good patient. You go through the risks and benefits of procedures. Nothing is absolutely without risk, and therefore you have to balance those risks. Where is the patient? What do they have? And where do they want to be? And what's that transition? And you have to be aware of that in order to make the appropriate decisions for folks. And for me, the most important thing is making sure that the patient is informed of all the risks and benefits so that they're in good shape. When they go in, they know what they're going to undergo and what to expect afterwards, so there are no surprises. That's the most important thing to me. I mean, we have new technology, new innovations, everything's faster, everything's more technical. I don't believe that that's the way you handle medical delivery of care to the patient itself. I enjoy and I take advantage of those technical aspects and those advancements. But once again, it's patient to doctor. That has to be a personal communication that it can only be done face to face. After surgery, I want to see those patients. I want to make sure that I'm available to them immediately. Total shoulder replacements will do anywhere from 2 to 8 a month, depending upon the week or what type of replacement we're talking about. We'll do resurfacings, total shoulders, hemiarthroplasties, reverse total shoulder arthroplasties, revision procedures where we revise somebody who's having who comes into me for a further evaluation of, say, a painful shoulder that was put in 5 or 6 years ago and somewhere else and is now experiencing problems, and we have to sit down and go through a kind of a complex algorithm about which direction are we going to go. We want to make sure that the patient gets the most advanced procedure, yet the most safe. What gives me the most satisfaction, and I have patients send me back pictures, I say, if they return to the activity that they love, archery, kayaking, canoeing, mountain climbing, any of these activities, I always ask them, once you get there, if you're happy, will you please send me a photo and sign it for me? I put it up on my wall. It makes me so happy to see them back doing what they love to do. That's the satisfaction I get, is watching these people return to the activities that they love. Fishing, golf, what have you. It's such that's why I do what I do.